Welcome back to the Health and Wellness Podcast.
I'm Omar, and with me as always is Hamdi. Today we're diving into a crucial topic in physical therapy, arteriosclerosis obliterans, also known as peripheral artery disease. It's a chronic arterial disease that mostly affects the lower extremities.
That's right, Omar. This disease causes the arteries to harden and narrow, limiting blood flow. It's a type of atherosclerosis, which we often hear about in terms of heart disease. But with arteriosclerosis obliterans, the arteries in the legs and feet are the main ones affected, and physical therapy can be a game changer for these patients.
Let's start by breaking down the basic functions of the circulatory system. So, arteries transport oxygenated blood from high-pressure areas, like the heart, to the tissues. Capillaries then connect arteries to veins, allowing nutrient and fluid exchange. And veins carry deoxygenated blood back to the heart. These parts work together to keep blood flowing smoothly.
That's a great summary, Omar. In addition to arteries and veins, we've got the lymphatic system, which is like the body's drainage network. It returns fluid from the tissues to the blood and helps with immune functions by filtering out cellular debris and bacteria.
Speaking of arteriosclerosis obliterans, let's talk about symptoms. The condition often starts with intermittent claudication, which is a cramping pain during walking. The pain can feel like burning, aching, or tightness. If the disease progresses, patients might even feel pain while resting or develop ulcers and gangrene on their legs due to poor circulation.
Right, an ankle brachial index test is usually used to diagnose it. It's a quick and easy way to compare blood pressure in the arm and ankle to check for blood flow issues in the legs.
Now, why is exercise so beneficial for people with this disease? Well, regular physical activity helps increase collateral circulation, which basically means creating alternate pathways for blood flow. It also improves endothelial health, helping arteries dilate better, which can reduce symptoms over time.
And it doesn't just stop there. Exercise can improve skeletal muscle metabolism and mitochondrial function, which are essential for energy production. Plus, exercise suppresses inflammation, which is really beneficial because inflammation can accelerate plaque growth in the arteries. And for patient intermittent claudication, the recommended exercise is often supervised treadmill walking. They're encouraged to walk until they feel mild to moderate leg pain, take a break until the pain subsides, and then start again. The goal is to reach about 50 minutes of walking per day, 3 to 5 days a week, for at least 12 weeks. Now, for those wondering if they can exercise on their own, supervised programs tend to have higher success rates. Unsupervised programs often struggle due to patient fears, lack of knowledge, or difficulty sticking to the routine.
And for exercise modes, there's a variety to choose from. High versus low-intensity weight-bearing exercises like treadmill walking versus non-weight-bearing like cycling, and even upper versus lower body exercises.
This flexibility allows therapists to tailor exercises to each patient's physical abilities. Overall, the goal is to improve circulation, build endurance, and reduce symptoms.
So, to all our listeners out there, if you or someone you know is struggling with peripheral artery disease, know that physical therapy and exercise can make a difference. Talk to your doctor and find a physical therapist who can set up a safe and effective program.
Well said, Omar. That's a wrap for today. Thanks for tuning in, everyone, and remember, with the right guidance and persistence, you can take control of your health.